So my task for this talk is to really give you a broad overview of the different types or different dimensions of stress. Stress is a very loaded word, as many of us know, and there are many different types of stress that Eli spoke about. What happens in our body when we are exposed to different types of stressors, and what happens to our behaviors, specifically physical activity or exercise adherence, and then is there any way that we can look, instead of looking at how stress affects physical activity, how does physical activity or exercise affect stress? And can we use physical activity as a way to reduce stress in the populations that we work in? So I am a childhood obesity researcher at the University of Michigan, and our primary focus is looking at disparities in health outcomes. So really looking at who's at high risk for for obesity and obesity-related diseases, and those are typically our high-stress kids. So kids who live in low-income environments, who are exposed to a lot of racial discrimination, and we want to understand, how does stress increase risk for disease, and how does it change different behaviors? It's no coincidence that our high-stress kids are also the ones who are not exercising. And so what's the intersection between those two, and how can we use physical activity or exercise to pretty much overturn some of those stress responses that we see? So as Eli mentioned before, we know the different dimensions. So there is stress exposure, there's stress appraisal or perception, and then there's the biological and behavioral responses. So we can see here, there are many different environments in which a child or an adult can be exposed to stress, whether it's at the society level, in school, as Eli mentioned, in terms of bullying or just school stress, teacher stress, in their neighborhood, if they live in a high violent neighborhood, or even just family stress. Changes in the family structure may produce different stressors. We also know that how someone appraises stress is very important as well, because some people who are exposed to a lot of environmental stress, they may become habituated to stress, and they no longer think that this is a stressful environment, even though it still will elicit a biological response. Vice versa, we know that with clinical depression, individuals tend to overestimate their stress or appraise a stressor as much more stressful than it actually is. So understanding how someone appraises these environmental stress is very important, because that will elicit different biological responses or even behavioral responses. Most of the literature has focused quite a bit on how stress impacts eating behaviors. So we're all familiar with stress eating. You're really stressed out, and so you just down a whole Haagen-Dazs cart of ice cream. But we are more focused on, again, stress eating, yes, but also inactivity. So a lot of the research demonstrates that when we get really stressed out, we're much more likely to engage in sedentary behaviors than physical activity. And over time, these can lead to differences in genetic or epigenetic expression that then leads to increased obesity, insulin resistance, inflammation, that leads to a whole host of different diseases. So again, let's focus on some of these things right here and see what the literature has to say. So just quickly, we know that the timing of stress or the duration of stress is very important. We have acute stressors, we have episodic stressors, and we have chronic stressors. Again, Eli kind of already pointed to this or talked about this, but an acute stressor means that it's short term. It has a defined endpoint. So you're running late in the morning to work. By the time you get to work, you're late, but that's a short-term stressor, something that happens really quickly. Episodic means that it's an acute stressor, but it happens frequently. I'm late every single day to work. So that would be an episodic, but by 5 o'clock, it's really not that big of a deal. Chronic stressors, these are more long-term stressors, so they're not just specific events, but stress associated with poverty. Again, caregiver stress, or job-related stress, or school stress. These are some of the stressors, so each one of these can activate different biological systems, and you can become reactive to stress, or looking at diurnal cortisol patterns, what happens to your biology in terms of over time. Eli presented a similar slide looking at the biological stress response. Again, most of you are familiar with this in terms of exercise, but we know that when someone is exposed to an external stressor and they appraise it to be stressful, that we have an activation of both the sympathetic nervous system and the hypothalamic pituitary adrenal axis. And this is what we mostly call the fight or flight response when we're talking about the sympathetic nervous system. This is when adrenaline and epinephrine and norepinephrine are secreted in high concentrations. We have increase in heart rate, respiratory rate, and this is to help us respond to that stressor, okay? We know that with the hypothalamic pituitary adrenal axis, the end point there is cortisol, and this also helps us respond to these stressors in terms of releasing energy substrates, increasing gluconeogenesis so that we actually have energy substrates to move or to fight. So both of these systems together allow us to get away from whatever stressor that we are exposed to. But in the case of psychological stressors, when we're not actually being chased by a bear, these systems can be overreacted over time if you're constantly being exposed to these different stressors. So your body does not distinguish between a physical stressor and a psychological stressor. These are activated regardless of the type of stressor. One other thing in terms of stress appraisal is that there are different types of stressors and we can appraise them differently. So challenge stressors typically activate the sympathetic nervous system, whereas threat stressors tend to activate the hypothalamic pituitary adrenal axis. So a challenge stressor is something that is demanding, but a controllable situation where a person has adequate resources to cope with that stress. So say preparing for an exam, or you have a bill that's coming up, but you've saved the money for it. This would be considered a challenge stress. Threat stress is something more difficult. Again, you do not have the resources to cope with this stress, and it's associated with feelings of distress or components of distress, feeling fearful. So again, if your self-identity is called into question, or you feel that you've been treated unfairly based on your social identity, or again, you cannot pay your bills, so you're not sure where that next paycheck is coming from or how you're gonna pay those bills, that would be more of a threat stressor. And that is more likely to increase HPA axis activity. Okay, and this is the type of stressor that usually increases stress eating, usually decreases physical activity, whereas challenge stressors have been actually shown to deactivation of the sympathetic nervous system, decreases digestion, and that you're less likely to eat in these situations. Okay, and the cool thing about these different types of stressors is that we can actually induce a stress response in the laboratory. So most ways that health psychologists induce these different types of stressors is you have somebody come up and give an oral presentation, just like I'm doing right now. And depending on how the audience responds to that stressor, so if you have them nodding, clapping, saying you did a great job, that would be more of a challenge stressor. But if you have some of the audience is kind of mean, they tell you to start over, you have to count, you have to do a very difficult mental task, then that is more, you will see a very large cortisol response both in children and adults. So here we can kind of replicate what might happen in real life situations and see how does behavior change in response to that. So what are some behavioral responses to stress? Both acute and chronic, in terms of exercise. So we know, some of this we already know because we work with people all the time and we have exercise interventions, and we know that with acute stressors, this tends to reduce exercise adherence. If you've ever done a 16-week, 20-week exercise intervention, little acute events, changes in your schedule, changes in, you have to study for an exam if you do interventions in college students. These different types of acute stressors can reduce an individual's adherence to an exercise program. So if you have a really high week of stress, this has been associated with exercising fewer days, you're omitting planned exercise sessions, less satisfied with their exercise, or even just have a lower self-confidence in their ability to meet their exercise goals for that week. What about chronic stress? Well, let's go to episodic stress, then we'll go to chronic stress. So again, in terms of exam stress, here is a study that showed in 180 college students that, they were divided into exam stress groups or control groups. These individuals did have an exam coming up versus students who did not. Here is the baseline condition. to where we can see differences in exercise, but over time you see a significant decline in exercise, how many days per week that they were exercising as a function of during this high stress time of midterms. So we know that even episodic stress can lead to changes in physical activity behavior. And even for chronic stress, we know that with chronic stress is associated with less frequent exercise in adults as well. This was done in 12,000 individuals. And we see here there's a whole host of different health behaviors in this table over here. But if we look at exercise, we're looking at the beta coefficients for stress and health behaviors. So the higher the stress the individual reported, you can see that negative or inverse beta coefficients, physical activities tended to go down in both men and women, particularly these higher intensity exercise, meaning structured exercise is declining the more stress people are exposed to. One of the things that we were interested in is looking at stress in kids. So stressing young kids, particularly African Americans, we know that that's a very high stress population. We know that teenage girls tend to experience much more stress than teenage boys. And we know that inactivity is more common in girls compared to boys. So is stress one of the links that is contributing to this high inactivity rate that we see in African American youth? And this is one of the questions that my students were interested in asking. So we collected data in 273 African American youth. In this analysis, we just used 144 who we had accelerometer data on. And they answered a series of questionnaires that were administered. We went to off-campus in community centers, after-school programs, to just ask them about their daily stress levels, their general stress levels, and they wore an accelerometer for a whole week, 1 to 2 weeks. And for the acute stress, we used the daily stress inventory, and some of the questions that we asked them just in the last day, the day before, in the past 24 hours, did you perform poorly on a task or thought about unfinished work? So these are some acute stressors for adolescents. And then they were asked, how did it occur? And then how much stress did it cause? Did it cause you to panic? Or did it just cause very little stress on a scale of 1 to 7? And we saw that when we looked between differences in gender, we saw that yes, the girls reported more daily stress compared to the boys, which is not surprising. This is similar to previous work. But daily stress seems to be higher in the girls. If we look at chronic stress, we use the perceived stress scale. This is a very common scale that's used both in children and adults. One of the questions is, in the last month, how often have you been upset because of something that happened unexpectedly? And then this is just asking about the frequency. We again saw that perceived stress was higher in the girls compared to the boys. Well, how are these girls or boys coping with their stress? If we look specifically, we used a 27-item coping scale questionnaire. Some of the questions were, well, I like to be by myself, or I bite my nails. And this was, again, asked about how often does this occur and how much does it help. And we saw that the girls, again, used more. It was a trend, but they tended to use about 20 different coping strategies where the boys only used about 17. And there was no difference in the effectiveness of coping between the boys and the girls. So even though the girls were trying to overcome their stress more, they did not, it didn't really help that much. Now, if we look at if it relates to physical activity, interestingly, even though the girls were more stressed out than the boys in terms of general stress and daily stress, stress predicted lower physical activity in the boys only. So this is a regression table where we see, looking at the boys for the perceived stress scale, we see an inverse relationship between moderate to vigorous physical activity. And for the daily stress, it was not significant, although there was a trend for physical activity to actually increase. So this was very interesting to us that different types of stress may have different responses for physical activity. These daily stressors may actually cause the boys to want to cope with that stress with physical activity, whereas these longer-term chronic stressors may actually, they're using other coping strategies to cope with their stress and not physical activity. So we dug a little deeper into that coping strategies questionnaire. There was a couple of questions. One was focused on walk, run, or ride my bike. or watching TV. So we have an exercise question versus a sedentary question. And for the exercise question, we did see that the boys were definitely, 74% of the boys were choosing to cope with with stress using physical activity compared to the girls. But both of them were overwhelmingly choosing to use sedentary behaviors to cope with their daily stress or their general stress. And it's even higher when you talk about food intake. So this is just an interesting for us to look at gender differences and how are people, even it may not just be the amount of stress, but how are people coping with the stress that they have, or both might be important. And this really comes when we think about trying to explain what is the conceptual model of how people are choosing to cope with their stress or choosing different behaviors. A lot of people have referenced Lynn Epstein's article that focuses on behavioral choice theory. That's saying that while we're choosing to be physically active, we also have many competing, very strong sedentary options that we can choose from as well. And when we get really stressed out, or when children or adults have increased levels of stress, that we're more likely to choose a sedentary behavior than we are physical activity, because we're wanting activities that have a greater reinforcing value, that are more accessible, and that actually also activate the brain reward system and give us some level of pleasure. Not everybody, it's only the regular exercisers who get that dopamine release and feel great when they're running. But most people, when they're stressed out, they don't really feel good, or they don't feel as good as when they're doing sedentary behaviors or engaging in sedentary behaviors. So an interesting article, so Lynn Epstein wrote the behavioral choice theory with James Romick, and James Romick actually tested this theory in the lab, looking at children's coping after psychological stress. Choices among food, physical activity, and television. So if you remember to the beginning of the talk when I talked about how you can induce a stressor in the laboratory, that's exactly what they did. They brought kids into the laboratory, induced a stress, got a nice cortisol response, and instead of just having food there, they had food, you could watch TV, or you could get on the treadmill and do some sort of physical activity. So they wanted to see what happens when what will kids choose to do when you have leveled the playing field in terms of the different types of physical behavior choices that you can engage in. So you see here, this is systolic blood pressure and perceived stress. So you definitely induced a stress response in these individuals. And you can see that the interesting thing was that the children who were dietary restrainers, so those who said, I shouldn't eat that, that's bad for me, let me stay away from different types of food. Those kids that were dietary restrainers, they actually ate a lot more food. So those are the individuals who consumed a lot of food. And the individuals who watched a lot of TV habitually, they just typically watch more TV than other kids, those individuals chose to watch more TV after the stress condition. And those who exercise, who typically engage in a lot of activity, they chose the physical activity after the stressor. So the question that we ask, or that I pose to all of you, is can we change people's coping responses? So if we increase the availability of physical activity, or have fun and engaging physical activities for both children and adults, is it possible for us to actually change how people cope to their stress based on the type of activities that they are normally engaging in? And that's one thing that we're interested in looking at, particularly in schools when we know that a lot of our kids are very high stress, and that is a high stress environment. Can we use physical activity to help kids cope with their stress? Finally, for the last part of this talk, let's get back to the biology and think about, can exercise actually buffer the effect of stress? So here we know, from the literature, what we know is that stress buffering with exercise, that we know stress appraisal, or what people think about stress, can be reduced as a function of engaging in exercise. Acute exercise reduces self-reported distress and anxiety, and this has been shown over and over and over in the exercise psychology world. We also know that the sympathetic nervous responses to stress also decreases. So Joe Romick has also done more research to show that if you do a physical activity bout, then you induce a stressor in an individual, that you will have a dampened stress response or cardiovascular reactive response during that stress condition than you would if they had not exercised beforehand. In individuals who are trained, though, these results are a bit more mixed, to where we tend to have higher reactivity, but they recover faster. So additional research needs to be done in terms of cardiovascular stress reactivity and exercise. But I think this is one of the coolest studies, especially for those of us who want to use exercise to dampen the biological stress response, is these individuals looked at the stress buffering effects of acute exercise on the hypothalamic pituitary adrenal axis. And let me take you through this a little bit slower. They had two different groups. They had an exercise group, a group that participated in 30 minutes of physical activity, and then a group that did not do, it was a control, no physical activity. They did kind of like a TSST, but it's not the same, but they induced a stressor in these individuals. And what you can see over here, this is the cortisol response, and these are alpha amylase response. Alpha amylase is, usually they take it from the saliva, and it's a measure of a surrogate measure of autonomic activity. And what you can see here is pre-exercise, post-exercise, that in the black bars is the exercise group, and you can see that, yes, cortisol was elevated pre and post-exercise compared to the non-exercising group. This decrease in cortisol here is probably related to the diurnal cortisol patterns. We know that it declines throughout the day. But during the stress, right before the stress and right after the stress, you see a similar, that you just see this dampening cortisol response, where in the non-exercising group, you actually see an increase in the cortisol. So this led them to believe that you actually see negative feedback going on, or a dampened response to cortisol, or to that stress in terms of cortisol, as a function of exercising before that stressor. And if we look at the alpha amylase data, again, we see activation here of the sympathetic or autonomic system during exercise. We also see activation during the stress. So again, we can demonstrate that these individuals did in fact feel stressed. This wasn't just that they did not feel stressed at all, but that there was a stress response. So 30 minutes of aerobic exercise was related to a blunted cortisol response. But I think this is one of the few studies that have actually looked at this. So if we think about exercise in terms of being a positive stressor, can we kind of change or reframe how we look at stress? So again, exercise shares many of the same characteristics as an acute stressor. So it requires a hemodynamic, endocrine, metabolic adaptations to restore homeostasis. So when you are exposed to a stressor, you are also exposed, same thing like with exercise, your body is going to try to get back to a normal homeostatic response. When we see if there's a sympathetic and HPA axis are activated during exercise, it's also activated during stress, and this is duration and dose dependent. We can also apply the FIT principle to stress responses. So what's the frequency of the stressor? What's the intensity of that stressor? How did it make people feel? How much distress was invoked? And then how frequently, how episodic is a stressor? So if we look at exercise as a positive stressor, or can we use it again to think about developing interventions to not only reduce the biological responses related to obesity or related to type 2 diabetes, but can we target the stress and the health behavior combined together? So what this is talking about here is just a cross-stressor hypothesis, and this was generated not by myself, but many researchers thinking about, can we use exercise, if we use the fitness principle, can we use exercise, give specific doses, a repeated physiological challenge of exercise, to then change SNS and HPA responses to not only exercise, but to the stress response. And can we do this with exercise training in children and adults, particularly our high-stress populations that need targeted interventions for both the stress response and their health problems? So these are my 3 take-home messages, and then I'll give the stage to Peter. That, again, when we talk about stress, there are many different dimensions of stress. We have acute versus chronic. We have threat versus challenge, how an individual is appraising it. And then we have activation of the sympathetic and the HPA axis. So when we're developing our interventions, we for 100% need to take on a mechanistic approach of what type of stress are we targeting, and how is our exercise dose going to target either the type of stress or the response to that stress. We know that there are many different types of behavioral changes that occur when people are stressed out, and those of us who do exercise interventions, we know that our high-stress folks are going to be less physically active or adhere less to our exercise programs. But we do know we have some preliminary evidence, we need more, that single bouts and regular exercise may be able to buffer this stress response. So in this high stress climate that we're in right now, how can we use exercise to improve the health and well-being of our patients and clientele? I think these are my students who collected a lot of this data, and these are our funders, and I just want to thank you for your time and attention.